So Gummy Smiles, I mean, you have a specific way you treat people, and you showed me a lot of photos of people that used to have Gummy Smiles and now they're gone.
Yeah.
So tell me about your approach to it.
I developed a system called Gum Lift back in 1989 that people who have Gummy Smile, I remove the gum, I lift the gum up, I trim the bone from outside and from the height and put the same gum higher up. So they end up with the longer teeth. And then I shorten the teeth from the bottom. So this combination I called Gum Lift. So as you can see from these pictures, what I've noticed is most of the people are not aware that there is a treatment for Gummy Smile. And typically the dentist's suggestion for treatment of Gummy Smile is just lasering off the edge of the gum. While that may work for 5% of them, for 95% of the people, just trimming the edges is a very temporary fix.
So trimming the gums is not enough for most people?
No, for only 5% that will have lasting effect. 95%, in fact, almost all the patients that I have, and I have patients coming from even Far East, as far as New York,
for your
New
gum
Jersey,
lift.
for my Gum Lift, yeah.
Are there that many people out there with Gummy Smiles? I mean, is this like a big problem?
You know, it's a big problem in the civilized world that people get a lot of braces. I've noticed when one of the side effects or end result of having braces would be a lot of Gummy Smile. And people who have it, they hate it. They hate it, but the problem is they don't know there is a solution out there.
Okay.
And when they go to the dentist for a solution, the only suggestion they get from their dentist is just trimming it with the laser. And that works only maybe in 5% of the people because
you only get so much gum off, right?
Yes, and then without removing the bone from underneath, that gum will grow back to provide that coverage of the bone.
Okay.
So the solution I have is not only I take the gum and put it higher up, but I trim the bone from underneath it so that the body doesn't see the need to grow more gum to cover that bone. And because I'm a general dentist and I do crown and bridge, I can do that to a great extent, and then when the teeth get longer, I shorten them from the other end with veneers and crowns. Like if they go to a specialist like a periodontist, they can do this bone trimming also, but they can't put the veneers and crowns and make the teeth back
so the
to normal
periodontist
size.
can do the surgery, but they don't put the teeth on top.
Exactly.
Like what you do.
That's right. And I've been doing this since 1988.
So you're kind of like the king of the Gummy Smile.
I was one of the first people who do it as a cosmetic procedure back in 1988. Yes. And I coined the term gum lift. That's my term.